Good evening, everybody. Welcome to the Masters of Science Speech-Language Pathology Class of 2022 White Coat Ceremony. My name is Dr. Linda Spencer, and I'm an Associate Professor, Program Director, and Chair of the Masters of Science in Speech-Language Pathology program here at Rocky Mountain. I'm honored to serve as your MC tonight as we recognize the dedication, intelligence, and works of this group of the MS-SLP students in our very first White Coat ceremony. This marks the transition from didactic learning, internal clinical learning led by faculty, to the starting in just a few weeks of a year of external clinical placements. I want to begin by acknowledging the presence of our faculty here, staff, and students. And during each little interlude, I will be introducing you to a little group of faculty members and staff so that you can meet the team who has been leading and guiding your students for this past year. First, we want to express our gratitude to all those who organized the event, including Ms. Lori Sisk, Assistant Vice President of Student Affairs, and the rest of the Student Affairs staff, Connor Rooney over here, Janine Farmer, I'm not sure if I've seen her, Daly Todd, Stephanie Bentley, Jamie Milstein, from marketing and communications, Tyler Anderson, Senior Director from Marketing and Communications. And our IT live stream group, we've got Jason Ritchie, Lorenzo Hubbard, Tanner Grenko, and Royal Chamberlain. So thank you all for making this happen. Second, I want to express my gratitude to the members of the administrative team and the guests that we have on stage, including Dr. Michael Nelson, who is the Interim Dean of the College of Medical and Professional Sciences. Next, we have Dr. Mark Horacek, the Executive Vice President for Academic Affairs and Provost. And last but not least, Dr. Richard P. Nielsen. He's the founding president and CEO of Rocky Mountain and the heartbeat of our university. President Nielsen completed his Bachelor's of Science degree at Brigham Young University, and because one is not enough, he also has a second Bachelor's of Science degree that he got from the University of Utah in 1975. Later, he earned a Master's of Science from the University of Washington, as well as a Doctorate of Health Science with an emphasis in clinical electrophysiology from the University of St. Augustine in Florida, and he is a physical therapist by profession. Dr. Nielsen also served in the United States Navy for over 20 years and held several esteemed positions, such as the physical therapy consultant to the Surgeon General and White House. After his retirement from the Navy, Dr. Nielsen co-founded and served as the president of the Institute for Clinical Electrophysiology, later became the one of the founding fathers of Rocky Mountain University of Health Professions. He's also affectionately known as Ranger to those who travel with him for World of Difference, a nonprofit agency which does service in Africa to promote empowerment, communication, engagement, resilience, and conscious leadership. So we are thrilled, President Nielsen, to have you speak with us this evening.
Thank you. Sounds like an obituary to me, doesn't it to you? I don't know what she's saying, but anyway, Dr. Spencer, an esteemed faculty, Dean Nelson, Provost Horacek, family and friends, loved ones, those of you who really are responsible for these, right? We welcome you all here today, and especially our esteemed students from the MSSLP program. It's a pleasure to be with you for a few minutes. I rode up on the elevator with 3 of you, and this is the first time that I've ever had a chance to really do face-to-face with you. And for those back here who know me, you know that I spend a lot of time face-to-face with the students. And the fact that I have to say, "Are you a student here?" is very unusual for me. So I look forward now that you're kind of back onto the campus, even though I know you're going to be going out into different areas, to get to know you a little bit better. So let me just share a couple of thoughts with you. They've given me 3 hours to speak, okay? But I'll try to keep it down to 2. Just to let you know, I speak 30 minutes to a wrong number. Okay, so talking is what I do. But I'll try to keep this short. When you don this white coat, this is a very significant thing. You know, it has a history way back hundreds of years in medicine. Originally was really to kind of protect the physician and the providers from the patient, you know, this little barrier. Nowadays, it's more of a rite of passage, going from more of a didactic or a classroom environment to a clinical environment. And even though you kind of spread yourself a little bit amongst the clinic while you're in the didactic phase, that's kind of the rite of passage we're talking about. But there's a significance to this coat that you have to be aware of. And you don't know this yet, and you'll probably not remember one thing that has been said here other than Dr. Spencer calling me Ranger, right? But this coat symbolizes 8 different promises or covenants or commitments that you make with yourself, your profession, your patients, and humanity in general, okay? So those 8 are, first, number 1, when you put on this coat, you're promising to all of those, including yourself, that you'll be accountable. Not only accountable for what you do, but accountable for what you don't do, okay? Accountability has 2 different dimensions to it. Number 2, that you'll provide effective care. Let your time spent with the patient, with the client, be effective. Okay? If that patient walks out and you can't say, "Wow, I made a difference in that person's life just now," then it was not effective. Patch Adams, you remember Patch Adams? He said this: if you treat the disease, you'll win some, you'll lose some. If you treat the person, you'll win all the time. Okay? Number 3, demonstrate continuous integrity in all that you do everywhere you are, not just in the clinic, but wherever you might find yourself in the community, in your neighborhood, within your own family, in civic and church or other groups that you belong to or associate with. Demonstrate continuous integrity. Let your standard be the highest it can ever be, ever. Number 4, practice compassion and caring in all that you do. Now, that's not just with your patients. Compassion and caring in all that you do. Inside and outside of the clinic environment, whether you're in a mall or in a store or you're walking down the street, look for ways to be compassionate and caring to humanity. That sets you apart from most of the people in this world. It was said by the Dalai Lama, if you want others to be happy, practice compassion. If you want to be happy, practice compassion. Number 5. Is that number 5? Okay. Number 5, excellence in all that you do. Now, let me tell you about excellence. I was raised by a single mother, and I was the youngest of 4 kids. And my mother spent a lot of time. She had a 9th grade education. I'm the first college attending person in our entire line of family. But she spent a lot of time with me. She taught me something about excellence in all that we do. And what she said to me was, be extraordinary in every single thing that you do. She said, ordinary people look and wait for opportunities. Extraordinary people create them. You are extraordinary. Everything you do inside and outside of the clinic, as you don this coat today, you're making a covenant to yourself, your patients, your profession, and humanity that you will be extraordinary in all that you do. Go over and above. Go way beyond the limits. Take the high road, okay, in all that you do. Number 6. Number 6 is altruism. Now, I don't know if you know the definition of altruism, but it essentially says when you put on this coat, you are agreeing that you will put other people's interests and other people's needs before your own. Okay? Always, always, always put other people's interests and needs before your own. That's altruism. There are many people out there who are deprived of medical education because our healthcare system has failed them. There will be opportunities for you to be able to render care even to those who have no means to pay you as far as money goes. Trust me, the pay will be much greater to you than money can give you. Never turn your back on a patient just because they don't have the means to pay. Number 7, let lifelong learning be part of your journey. Now, you've been here learning. We've been training your hands. We've been expanding your minds. And we've been enlarging your heart and softening your hearts, right? Let lifelong learning be part of your journey, even beyond when you graduate here. Never miss an opportunity to be able to continue to train your hands, to expand your understanding in your mind, and also enlarge and soften your hearts to humanity, including your patients. And number 8, generosity. Be so generous that generosity becomes part of your character and your identity. Let people know you because of your generosity. And generosity has nothing to do with how much money you may give. Generosity is how much of you give to the world. So as you don this white coat today, remember those 8 things, even if you only remember one of those, okay? Make that as a memory to what you agree to when you wear this white coat. In closing, one of my favorite quotes that I say all the time, because I probably repeat this to myself 20 times a day, because I try to live this. And I share this with you in closing. And it's from a good friend of mine who I never met, but his name is Leonardo da Vinci, okay? In 1490, he was born even before me. Hard to believe. In 1490, Leonardo da Vinci said this about you, okay? He looked forward into 2021 and said this about you. He said, it has long since come to my attention that people of accomplishment, okay? That's you. People of accomplishment rarely sat back and waited for things to happen to them. Rather, they went out and happened to things. So students, as you now don the white coat, and as you leave here today, regardless of when you go to the clinic or where you go, or even beyond that, go out and happen to things. Happen to your family. Happen to your next door neighbors. Happen to the people in your community. Happen to your patients. Happen to your professional associations. happen to the world. Go forward now and serve, lift, and build. Bless you. Thank you.
Thank you, President Nielsen. This evening, you're going to be hearing from a student speaker who was selected by the class, a faculty member who was selected by the class to speak, and the class co-presidents. But before we hear from our first guest speaker, I'm going to introduce some of our clinical faculty who have been overseeing the internal clinical experiences that your students have had for this past year. Faculty, as I say your name, if you would come and stand right by me and just stay here until I let you go. So first, L.B. Stonier. L.B.'s area of expertise is sarcasm. No, I'm sorry. Sorry. It's actually pediatric feeding, early intervention. Miss L.B. came to us by way of, she came to Utah by way of Idaho, but we took her anyway. And we're very, very happy to have her. Mr. Tim Stockdale. Mr. Stockdale's area of expertise is swallowing disorders and aphasia. Mr. Stockdale came to us by way of Florida. And again, we're very happy to have him. And Ms. Kristen Ibsen. And her area of expertise is early intervention, language, and literacy. Ms. Ibsen came to us by way of Utah, and we're very, very happy to have her. I also want to say that all three of these faculty members serve as mentors, as listeners, and have devoted so much time this year in creating the opportunity for you all to be ready to go out into your externships. And they also model scholarship because all three of them are studying and ready to get their clinical doctorates. So thank you, three. Now I'm going to introduce the student who was selected by the class to share some words of wisdom and encouragement. Allison Caudo. She comes to us from Orange, California. She obtained her Bachelor's of Science in Communication Disorders from Brigham Young University with a minor in linguistics, and she did that in 2018. She taught second grade just around the corner from our building at Treeside Charter School. She worked as a research assistant in the laboratory of Catherine Cabbage at BYU. Allison is known and loved by her cohort for her easygoing and down-to-earth personality, her strong clinical skills, and her supportive friendships. Allison.
So you wish to know all about my grandfather. Right now, all of our friends and family are sitting there thinking, inside jokes. I'd really love to be a part of one someday. For those who didn't get the joke, let me fill you in. That phrase is the opening line to a standardized passage that speech-language pathologists use to collect a voice sample from a client. We read it all the time, we hear it in videos we watch for class, and soon we'll be using it when evaluating our own client's voice and speech characteristics. Welcome everyone to this special experience. I'm honored to be the speaker tonight and for this opportunity to address you all in this setting. In person, may I add, that's been great. I'm honored to be receiving white coats with my stellar cohort. I'm not sure how we all got so lucky to have ended up together, but I think we knew from the start that this was a really unique group of people. We've all overcome a lot in the past year and a half, not just us students. But as students, we've had to adapt completely to online courses and very minimal on-site interaction. And somehow we did not let this stop us from creating deep friendships filled with virtual study sessions, movie nights, and lots of group chats. At this point in our education, we've learned not only how to create lesson plans, run a session, collect data, write SOAP notes, but we've also learned how to make sessions a safe place for our clients, how to build rapport, and how to help them make a functional difference in their lives. This ceremony reflects the halfway point in our educational journey as we prepare to take on full-time clinical responsibilities. Traditionally, a white coat ceremony is an academic ritual that marks a student's transition from preclinical studies to clinical practice. It's true that this ceremony is usually associated with like doctors and dentists and things. However, this rite of passage is being extended to other healthcare professionals, working so closely with patients and medical teams, diagnosing within our scopes, and implementing patient-centered treatment plans qualifies us for this honor. Receiving this white coat does not come without responsibility. Rather, it symbolizes a dedication to professionalism, to clinical inquiry, and to deep knowledge in our given field. This fall begins our first of 3 clinical externship experiences. As we are placed into various settings, we will get the chance to apply our knowledge and skills and treat and/or assess real people outside the comfort of our university's clinic. And no, it won't be just in schools treating lisps and those tricky R's in children. I'd like to briefly attempt now to explain how wide the scope of an SLP is. You see, an SLP may be necessary from the very first few weeks of life, when a new mom discovers her baby has a tongue tie and struggles with feeding. You may need an SLP when your 2-year-old hasn't said his first word yet, and you're starting to think he might not just be a late talker. You may need an SLP for your 13-year-old son who has autism and has trouble saying the right things when trying to make friends. Or when your 19-year-old daughter tragically suffers a traumatic brain injury from a car crash, and she needs to learn to speak again. We also work with transgender individuals who want their voice to be a reflection of their most authentic self. You would use an SLP if your spouse had a stroke and now has trouble finding the right words to use and who coughs a lot after swallowing. SLPs may treat your grandfather with Parkinson's, whose voice sounds a little bit soft and monotone, and he has vocal tremors. We would definitely work with your grandmother who developed Alzheimer's and benefits from a memory board to keep track of her grandkids' birthdays and other important life events. And you would have an SLP on the team when your uncle with ALS needs a communication device to tell his family he loves them one last time. Speech-language pathologists can be used at quite literally any point in your life, from the day you're born until the day you die. We as students might not be quite in that place yet to treat all of those cases. However, we've learned a lot, and we are getting closer every day. To my cohort, one thing I'm confident about is that we've been given the right tools that we will need in order to be successful clinicians out in the field. We know a lot more than we think we do, and imposter syndrome can surely take over at a time like this. But I want you all to know that you are prepared and you are qualified. I'm excited for the year that lies ahead of us and for the vastly unique experiences we will all have. I think this cohort was meant to do big things, and I can't wait to see where our careers take us. I want to thank you for this opportunity to speak to you, and I want you guys all to know you deserve this. Thank you.
See what I mean? Thank you, Allison. Now I'm going to introduce two more faculty members who are both beloved and bestowed with knowledge and wisdom. Our newest faculty member, Dr. Priscilla Danielson. Yeah, right here. Sorry. Don't know my right from my left here. Dr. Danielson's clinical specialty is augmentative and alternative communication and language development. She came to us by way of kind of Pennsylvania, Delaware area, and we have just so enjoyed having her this year. We feel so fortunate. And then Dr. Philip Septum. You can tell they don't like him too much. No. Dr. Septum, his area of expertise is the neurological aspects of communication, swallowing disorders, and both rigid and flexible endoscopy. Dr. Septum came to us by way of Kansas, and we're glad the winds brought him here. Thank you. Our next speaker is Ms. Wendy Chase, who was selected by our students. Ms. Chase is the Director of Clinical Education here at Rocky Mountain University. She's also the recipient of the Rising Star Teaching Award at Rocky Mountain this year, which is the highest award bestowed upon somebody who's in their first 5 years of working at Rocky Mountain University. She has 29 years of experience in clinical positions, treating clients from infancy through geriatrics, and in locations from home care to hospitals. Ms. Chase was most recently employed, not deployed, at the Director of Clinical Education at the University of Connecticut, where her focus was on interprofessional education and practice, communication, and voice treatment with transgender or gender fluid clients. She also worked with assessment of swallowing in clients with ventilator dependency. Her classroom incorporates team-based learning, and she and Dr. Septum have teamed to form an amazing hospital simulation teaching sequence, and we just finished one of those sequences last Friday. Ms. Chase believes that critical thinking and evidence-based and evidence-informed education should inform us as we practice. The other thing about Ms. Wendy is she's pursuing her PhD in health sciences and health professions education. So we are so grateful to have her study clinical leadership, and we look forward to hearing from her this evening. Ms. Chase.
Hello, everyone. Thank you for selecting me to speak to you. I think that your cohort holds a special place for all of us, both because of your unique qualities as a group. Every cohort has its own personality, and you are not exempt from that, but also because of the unique set of circumstances that have been involved in your education. We've all had some barriers, we've all had some mountains to climb and bridges to build in order to allow your education to take place. And so this group will always have a unique position in our hearts and in the program's history. And let's think about that. You're making history in this program by your very presence and by the fact that you had the resilience to continue working through the challenges of this year, which we know will continue in some ways, but are also getting better. I thought for a brief moment about having my speech consist only of 2 words, which would be, what else? But then I thought that was probably gypping all of the audience from getting a few more words out of me in this presentation. So I trust that you will all remember those words and ask them of yourselves constantly as you push the boundaries of how you think about your patients and your clients and what you need to do with them. What I would like to talk about is a little bit about your journey so far, and let's reflect back a little bit on how we've gotten to this point tonight. So this ceremony this evening, obviously, is a step in a journey. You're not there yet, you're not done, you're half-baked. Maybe that doesn't come across quite right. You are at the midpoint of your clinical and academic preparation for professional practice. But let's think about what's come before tonight. Okay, so first, you all had to decide that the profession of speech-language pathology was the one where you could build your unique personality and your perspective and your abilities into your professional persona in a way that led to the betterment of other people. That's a pretty cool decision. You all came to it in different ways. You all had your own experiences and influences in your life that brought you to this profession. We're really, really glad you made that decision. Your faculty as a whole thinks that this profession is probably the coolest thing on earth. We are deeply indebted to the people that taught us, and we want nothing more than to help share that passion with you all so that you can go forth and do good things, which you will do. But we had to make that decision, and so did you, to come to this profession. So thank you. Thank you for wanting to join this group. Thank you for wanting to share who you are with the people that are going to need you and benefit from your skills. Secondly, you had to learn a few things this year. You had to learn to assess situations, people, tests, treatment practices, literature. You had to learn to assess those things. You had to learn to treat. You had to learn to devise and select and implement protocols that made sense for that individual. You had to learn to write in a way that a professional represents what they just did and how that patient performed. You're getting there on that one. That one's a work in progress. Definitely coming along though. You had to learn about diseases, and you had to learn about disorders, and you had to learn about differences, all of which provide the foundation for the things that you will do within your career. You had to learn about cultures. You had to learn about ethics. You had to learn about legislation and laws. You had to learn about practice standards that are different based on where you are. You had to learn about settings. You had to learn about instruments. You've learned a lot. Now is your time to integrate all of that information and apply it forward to a unique experience. Once you had all that information, you needed to start thinking beyond knowledge and skills and into the area of practice where your brain can make those transitions between a piece of information. Okay, who's judging my gestures right now and determining my nonverbal characteristics? Take those pieces of information and weave them into a rationale for the best practice that you can provide. And you've started that process. As you go out into these placements, this is what you're going to refine. You're going to add new pieces of information. You're going to add new techniques. You're going to add all kinds of new learning. And you're going to weave a cloth that supports your career for the rest of the days that you work it. And it's going to keep on growing. You will weave until the day you die, or we will come after you. Because lifelong learning, no kidding, is really, really important. Okay, so the last thing we kind of asked you to do to get ready for this transition in your practice is to learn how to become a more conscious, reflective practitioner. So you've got all this now. But it doesn't become refined without recounting and reconstructing the experiences so that you can pick them apart and look at what you have done well, what you have mastered, what you have created that's made an impact, and also identify the opportunities for ongoing clinical inquiry and asking yourself, what else? What else could I have done? What else could I learn that will change this outcome? And as you begin to incorporate that reflective practice into your experiences in your placements, you will find that your success is astronomical. There is no way for you to fail if you accept reflective practice and the idea that mistakes are okay. You don't have to learn everything before you go to learn things, okay? You have learned what you need to go into those settings and take the learning from it as you build. So tonight represents the passage from discrete learning of concepts and statistics and techniques to a much more integrative learning experience. It includes self-awareness, self-advocacy, and lifelong learning. After tonight, you will practice navigating your way along your client's path to building your own professional persona. Your speech-language pathology persona should be a culmination of the pieces you have chosen and learned from a wide variety of opportunities. You are your own person. The only way to create yourself in this profession is to be exposed to as many ways of thinking and doing as possible. And you're about to enter a whole nother year of a lot of different ways of doing things and lots of different ways of thinking about things. Open your mind to all of them. Search them out. Add them to your toolbox. And select the ones that work within your skill set and your personality. And you will be an exceptional professional. When you step into a fellowship at the end of the next year, you will feel differently than you do tonight. You'll still be a little scared. You'll still be worried that you don't know enough. But you will be able to rely on what you do over the next 3 semesters to show you what you have within you. It's there. The building blocks are present. Own them. Climb them. Stack them up as high as you can. And don't worry too much if we knock them down occasionally. That's our job, okay? You will recognize the opportunities, you will take advantage of them, and in so doing, you will be the embodiment of our university and the future of our profession. And that makes us really, really proud. We have faith, we have confidence, and we have delight in watching what's going to happen over the next 3 semesters. And we can't wait to see it and work it with you. Go forth. Thank you.
Okay, now as we prepare to bestow the white coats, I want to introduce you to Ms. Lauren Murray, our clinical educator. And Lauren, you could stand up. Thank you. Stay standing. Ms. Murray's role is to facilitate the externships that you're about to embark on for every one of our graduate students this final year. She maintains the relationships between our universities and the facilities and preceptors who mentor our students. She connects RMU to Alaska, all the way down to Florida, and we couldn't do it without her. Thank you, Ms. Murray. And finally, Ms. Herget. Ms. Sasha Herget, who is our internal RMU Center for Communication Disorders Clinic Coordinator, and our department administrative assistant. She's someone all of our students know. They talk with her many times during the day, and they rely on her to help them transition into that internal clinical aspect. She will be reading the names of our white coat recipients.
Andrea Adeboyja, Katy, Texas. Amy Bates, Stanton, Virginia. Alexia Carrillo, Livermore, California. Jalen Cosby, Jackson, Ohio. Allison Cowdell. As mentioned, Allison is from Orange, California. Russell De Jesus. Russell is from Calamba, Laguna, Philippines. James Devine. Jimmy is from Huntington Beach, California. Claire Draghi. From Nashville, Tennessee. Julia Dugan. From Plano, Texas. Elizabeth Evans. From Indianapolis, Indiana. Stephanie French. From Willimantic, Connecticut. Camila Gonzalez de Paz. From Richardson, Texas. Amanda Goodner. South Jordan, Utah. Amy Gwynn. From Bloomington, Minnesota. Sadie Hoverter. From Vashon, Washington. Megan Hubania. Albany, Oregon. Aaron Huber. Layton, Utah. Katie Klein. Fountain Hills, Arizona. Veronica Lima. Miami, Florida. Brecca McCormick. Alexandria, Minnesota. Callista McMullen. Santa Clara, Utah. Sarah Meeks. Mesa, Arizona. Samantha Matola. Tempe, Arizona. Monica Muhlstein. Riverton, Utah. Veronica Nada. Violet Louisiana. Emma Regosa. Long Beach, California. Sahara Skagen. Tannersville, Pennsylvania. Ashley Spindler. Nibley, Utah. Summer Stegelvik. San Clemente, California. Kirsty Trees. Riverton, Wyoming. Akaite Udo. Houston, Texas. Darcy Paola Valadez Ramos. Brownsville, Texas. Catherine Wolf. Jessup, Georgia. Our final three recipients are joining us virtually. They are Kelly Ascanio. Kelly is from Raleigh, North Carolina. Aya Khalil. Seattle, Washington. And finally, Jacqueline Hamlin. Evans, Colorado. Please give one more round of applause to our 2021 White Coat recipients.
Okay, now I'm going to be turning the program over to the co-presidents of the class of 2022, Camila Gonzalez and Summer Steglovic. Come on up. just want to make a program note. We had a misgiving in the program. Our program is a little different. We have co-presidents because we're very team-oriented, and Summer's name was left off as one of the co-presidents. So these two are our co-presidents, and they're going to be doing our oath and the two oaths and the mission.
Hi, everyone. I promise I'll make this quick. I know I talk a lot. So first of all, thank you so much to all of our support systems, whether you're here or joining in virtually. We really appreciate you. I don't know if we could have gotten through neuro without you guys, so I appreciate y'all. Without further ado, Cohort 4, please stand and raise your right hand for the oath. All right. As I begin my clinical service, I dedicate myself to promote the autonomy of my patients, to serve with a beneficence, to act in their best interest, and to assure that they will benefit from my care and treatment. I will strive for justice and access to treatment, to preserve the dignity and the confidentiality of those that I serve, and to communicate with my patients and their loved ones with honesty and truth. As a speech-language pathologist, I promise to work towards advancing science, setting standards, fostering excellence in professional practice, and advocating for the members and those that I serve. Thank you. You may be seated.
All right. Can you hear me? Okay. I'm going to go over to the mission that we created as a cohort. So the mission of Cohort 4 is to encourage autonomy and passion amongst one another and make meaningful contributions to the field of speech-language pathology and beyond. We strive to demonstrate competence within our scope of practice and educate others on our field service. Cohort 4 is dedicated to lifelong learning by engaging in reflective and collaborative practice. We aim to express our enthusiasm for patient care through holistic, patient-centered therapy services. We seek to illuminate total communication and well-being of our patients by recognizing their diverse and individual needs. Finally, we subscribe to the belief that communication is a human right and commit ourselves to giving our patients the respect and priority that comes with this absolute. Thank you.
Thank you, Camilla and Summer. So in closing, we want to let you, family, friends, and loved ones in on a little secret about this group and this class of individuals. As a faculty, we cannot be prouder of how they have persevered during this time of drought, of pandemic, and overall uncertainty. I'm going to give a quick story to just illustrate the core of this group. Yesterday, a small group was working together to learn how to do an endoscopy procedure. That's a procedure where you literally thread a camera that's on the end of a little tube up somebody's nose. So here's what I witnessed, and this is really typical, a really typical situation that you'll see. So on the one hand, you had a student who was the patient, and he actually had this camera that was, as I said, affixed to this tube up his nostril. So this camera was inserted up his nostril all the way to the level, and it was perched just above his epiglottis. So he's got this in his nose, and the whole time he's encouraging the person who is learning how to insert this camera in his body. And he's guiding that person, and he's telling the student clinician, okay, go a little to the left, okay, now to the right, and go up a little bit, okay? Yeah, Catherine, you love those babies. And And then the group observing is also cheering the person on who's learning how to thread this through his nose. And they're like, super job, you've got it, what a good view. And they know very well that they're on the hot seat next. But that didn't matter to them. At that point in time, they were there to serve each other. And that's just a little bit of a story that illustrates what happens every day with this class. As I watched that sequence repeat 4 times, four insertions at least, I just have to say I was inspired and I was humbled and very, very reassured. We as a faculty want you all to know that this class is all in all the time. They sacrifice, they serve, and they give us hope. We're in good hands. Thank you, everybody. We do have cookies. I don't know where they are. I didn't locate them. Oh, they're at the back table. The back table. So you're all invited to go and get a cookie and a drink and enjoy your evening. Thank you.